I am Dr. Naval. I am a pediatrician and a bronchoscopist. I am highly specialized to deal nasobronchial problems of children, respiratory problems, allergies, asthmas, postnasal drips. So we would like to talk about nasobronchial allergy, which is increasing day by day because of the pollution levels, because of changing environment. These problems are on rise. So we would talk about nasobronchial allergy. Nasobronchial system is one system, it's part of the same system. Some people have more of a nasal allergy, some people have throat problems, some people have recurrent lung problems. Most of the people would have all the problems together. It may start with a running nose, it may start with a slight cough, normally lands up including the whole system. It has a familial or a genetic predisposition to it. All people don't suffer from it. Only people who have a genetic or a familial predisposition to it suffer from this. Familial or genetic predisposition means 3 generations up and down. If you try to figure out, somebody or the other in your family would be suffering from one or the other forms of nasobronchial allergies. Somebody may have cold, somebody may have a recurrent sneezing, somebody may have a recurrent blocked nose, somebody may have a dry hacking cough, somebody may have sore throats, somebody may have severe coughs, somebody may land up on ventilators, somebody may have a severe wheezing. So intensity may vary, but most of the people in your families, one or the other person would be suffering from small or more of nasobronchial allergies. Why does it happen? What are the precipitating factors? Dust, smoke, pollen from plants, animal denders, smells. Smells are very potent factors like goodnight swallows, paints, polish, varnish, kitchen smells, incense sticks, deos, perfume sprays. Changing weather is a very big factor. In and out of AC, in and out of heater, damp walls, humid weather, viral infections, all these, any or many of these factors may lead to an attack of nasobronchial allergies. Then what happens in a nasobronchial allergy? Normally, 2 things happen in a nasobronchial allergy. One is constriction of the windpipe, second is coughing and sneezing. Coughing and sneezing are basically protective reflexes. Anything that you inhale and is not conducive to the body, by the reflex of sneezing or coughing, the body tries to bring it out. By constriction, by constricting it, by constricting the windpipe, body again tries to stop the inhalation of any allergen that is not conducive to the body. What happens in bronchoconstriction? There are 2 processes that happen. One is swelling of the windpipe, which is called as inflammation. It's a reversible airway disease. It's a reversible inflammation that happens, reversible swelling that happens, and narrowing of windpipe happens. So what do you do to treat it? First is prevention. Try to avoid the precipitating factors. Try to avoid the dust, smoke, pollen. Don't be there while you're brooming the house, while you're dusting the house. Try to keep your pillows, mattress, bed sheets vacuumed. Try to have no rugs, no carpets, light curtains in your house. Clean them properly. Try to vacuum your walls once a week. Try to have no cockroaches. Try to have no pets in your house, no flowering plants in your house. So many of these factors, if you are able to take care, your problems would decrease. And then there is a treatment to it. Treatment is basically a combination of anti-inflammatories and bronchodilators. There is a step-up treatment, there is a step-down treatment. More the problem, more the treatment. More the problem, step up the treatment. More the problem, step up the treatment further. Lower the problem, step down the treatment. If there is no problem, stop the treatment. If there is a problem, restart the treatment. So there is no course for this treatment. It's like an adequate treatment. The number of days your problem persists, treat the patient. If there is no problem, stop the treatment. Treatments are combinations of bronchodilators and anti-inflammatories. Inhaled drugs are better than oral drugs. Oral drugs are better than injections. Inhalers, rotahalers, nebulizers, they are devices which would give you inhaled drugs. And that would be the first line of treatment. They should be used most often. There is a myth that they are habit forming. Actually, they are not habit forming. They are the most conducive to your respiratory system. They don't cause you tachycardias. They cause least side effects. In case there are any side effects, they cause the least side effects. So that is why we would prefer, or any doctor would prefer, to give you inhaled drugs better than before the oral drugs. Thank you.